Thank you for attending our annual general meeting of 2024. And I'm Rachel, I'm the Chief Executive of the Patient Association and delighted to be here with you. So here is the agenda. I'm here to just introduce you and I'll come back on again in a while. But in the meantime, I just want to hand you over to Julie Tallon, who started as our chair in January of 2024 and will be reflecting on the last year. So Julie, thank you so much. And I think Dawn, my screen isn't showing Dawn, who will come on as well. And Dawn Bretton is our treasurer and will be giving you an update on the end of year finances for 2023.
Thanks, Rachel, and good morning, everybody. To those of you who were with us earlier, good morning again. And for those of you who have just joined for the AGM, thank you for taking the time to join us again this morning. As Rachel said, I have been chair for just over 8 months now, and before that was vice chair for 2 years. So I've been with the Patient Association for a little while now. And again, as you will have heard earlier, I'm a nurse by background and fairly grounded in the NHS. So it's great to be part of an organisation that's a real advocate for patients, as opposed to having been involved in it for such a long time. And I think we all know that navigating the NHS has always been quite tricky, but it's really difficult now. So I think the job that we have and we do is even more important than it was. It's a great privilege for me to be part of the Patients Association. As I say, having been a clinician and a manager in the NHS for such a long time, I feel I have a kind of an obligation to give something back, and this is a great way of doing it. It's been a really busy year. 2023 has been a busy year. As I didn't take over as chair until the end of the year, but we had some trustees that left and some new ones that joined us, which is a shame for those who leave, but great to get new people in with different skills and expertise, and they add such a lot to the organisation. We've also got some new staff, which has been great. Again, it's always a shame when we lose people, but having new staff start is always stimulating and interesting for all of us, and it's been good. And we put on some amazing events last year, which we'll talk about again very shortly. Been involved in policy making and also been part of national events elsewhere. So it's been a busy old year, and 2024 looks busier still. It has been already, and we're only just over halfway through. So again, welcome and thank you. I think you will all have been sent a copy of the minutes from the AGM of last year. We haven't had any comments or questions back on those, so I would propose that we adopt those, since nobody has objected and we haven't had any corrections. So thank you for that. If we could move on to the next slide. So just talking about some of the key achievements, as I mentioned, it was our 60th birthday last year. We slightly changed our logo. You may have seen it to celebrate. It was almost the same age as me, but so 1963 we started. Been an interesting journey. We've had our ups and downs, but I think we've gone from strength to strength, particularly over the last few years, and have really found our place as a fairly significant voice and advocate for patients, and working at the most senior levels, which has been really good for us. Our focus on patient partnership and service design and delivery hasn't wavered this year. We've done a huge amount of work around that area, and we've also increased our membership by 20% in 2023, which is amazing, and we now have 3,523 members, of which you are a number. We're always looking for increasing our membership, because we're always grateful to our members for what they bring to us and for the activities that they engage in, and the information that they provide for us, and they're always welcome, and it's always interesting to hear the stories and to be able to engage with them in what we're doing. So if you know of anybody else who wants to join, please feel free to encourage them. The helpline took over 3,000 calls, which is huge, considering we only have 3 people and they don't work full time. They always provide a great service, and we get lots of compliments about the work that they do. And 3,000 calls is no mean feat for them, and again continues to increase. You'll all be familiar with our website. We've had 287,300 views across 150,000 plus users, which again is great. We also send out newsletters and updates on a weekly basis, which get viewed as well, and people find interesting. So it's good to know that the information that we're making available is so useful and helpful to people. We've undertaken some large-scale patient surveys and focus groups, some of which have been, for ourselves and for our own information, but often we're commissioned to do that for other people. And again, this is, partly where our membership, but other people come in as a real asset to us, which we're grateful for. And we've participated in some key NHS and government advisory groups, which is always gratifying when we get approached by regulators and policymakers to be involved, because that's where we can really have our most impact in being, really good advocates for the patients. So we've been involved in a number of those in 2023, which has been amazing, and that has continued into 2024, which of course we'll report next year. But there's been no letting off of that, which is a great achievement. Next slide, please. Patient Partnership Initiative, which is of course the core of who we are and what we do. We held our second annual patient partnership last year, and we've got the third one planned for September this year. So please look out for that and join us on the webinars that are planned during that week. And if you've got people who you think might be interested, please pass on the details and encourage people to join. We always have good feedback on those, and people find them really interesting. So please do join. We had 13 in 2023. I'm not quite sure what our aim is for this year, but we've already had a number and have more planned. So like I say, they are still available for people to see, but they're very good value for fairly short pieces of information. We've partnered with the NHS organisations at national and local level, and continue to promote what we do with them. Again, this is where we can have our most impact by working at these levels. So it's good that they call on us. And we contributed to the COVID-19 inquiry as a core participant, which is great because increasingly the patient voice is being brought in to some of these fora, and it's really good to be part of that. So that was a really welcome invitation for us. Next slide, please. And we've also undertaken some key projects and been involved in some research in the last year as well. We conducted a patient experience survey in the winter. We all know that winter is a really difficult time in the health and care sector for a variety of different reasons, and we were involved in doing that experience survey so that we could feed back into what can be done to try and improve the patient experience. We often get caught up in, or the NHS gets caught up in just churning through work without actually, and just seeing the end goal as having done the work, as opposed to how it actually feels and looks for patients who often get a bit of a raw deal when they get caught up in a busy service. So doing that experience survey was really important and provided some really useful information. We worked on the data pack development with NHS England around accessing patient information, which was a really good piece of work. And we're involved in the NHS communication study with Engage Britain and the PMA, which was really good too. There was a piece of work on elective surgery hubs and getting patient feedback on those and how they work and the patient's experience of working through those. Again, often, new initiatives get set up and patients get sent down particular pathways or through processes for their care or their needs, and taking time to actually work out whether they were the right things for patients and whether they work for the patients and not just for the clinicians and the services is really important. So that was a really important piece of work that we were involved with. And equally the outpatient strategy, which we helped develop with the Royal College of Physicians and NHS England, which again we were really pleased to be involved in. I think I'm handing over to Don now, who's going to run through his Treasurer's report. So good morning, Don, welcome, and I'll let you talk about the money. You might have to take yourself off mute. Ah, there you are. Morning, Don.
Morning. Thank you very much, Julie, and welcome to everybody. I'm going to run quickly through the Treasurer's report. And before I turn to the slide, which is on the screen, the financial report as part of the trustees report, you all can access that, and you will find more details on page 8 of the report and page 9, which shows the balance sheet, and in particular the importance of legacy income, which we've enjoyed this year. Now, there's two main things I think I need to communicate when it comes to the financial report. One is that the independent examiner is required to look at our accounts, check that we're following all the rules and that everything is in order, and he's given us a completely clean bill of health. Similarly, he looks at what we've said about being confident of being a going concern, i.e. that looking at the year ahead, at least covering the year ahead, that we're satisfied that the figures in front of you indicate that expenditure and income will carry us through the year, and that we will maintain reserves to meet any unexpected contingencies. So if we look at the slides now, we see that the reserves are set at 308,987, but the surplus is 88,295. That's this year over what was budgeted and compared with the figure for last year. And the unrestricted reserves, therefore, at the 31st of December are shown at 397,282, which is a very satisfactory result from the viewpoint of the board, and compares very favourably from where we've been in recent years. I think it's important to say that we don't rely for the future on legacies, because legacies by their very nature come as a pleasant surprise to us, but nevertheless they do come unexpectedly, and we don't control their timing. But with the extra resources, we've been able to increase the size of the financial staff advising the board, and we're working towards having a clearer plan, hopefully looking 3 years ahead, showing where we can get the income to meet the expenditure which we need to maintain. I'd just also like to say, Julie, that of course a lot of the income is created in year by the projects which are run by the chief executive and her team in the organisation, and so we all have to be very grateful for the amount of work they put in and their success in promoting projects which provide an income to the organisation. But I think that's all I need to say.
Thank you, Don. I think we're handing back to Rachel now.
Brilliant. Thank you, Don, and thank you, Julie. So you'll remember that when we wrote out to you about the AGM, we asked about voting in our different amendments that we had. And I'm delighted to say that all of the issues raised here around our accounts, which Don has put to you, the minutes to approve McIntyre Hudson as auditors, to re-elect Julie as trustee, thankfully, and Don as trustee and honorary treasurer, Rach King, Wikas, Meryl, Alf, and Tom back on our trustee board. And I have to say, having the opportunity to work with trustee board is really beneficial to me, and it's great to have them all re-voted in. There was a few people who abstained, but overall it was unanimous in voting these people in. So I'm going to leave that there, but we can, if anyone wants to see the actual voting results, we can send them to them. So I think we can move on to the next slide because we don't have much time. And I think this is me again. And I want to pick up on a couple of bits before I look ahead, because we're halfway through 2024. I get that. So I want to tell you a little bit more about what's happening. But we continue to see a massive increase in our membership, and we're now up to over 4,000 members. So thank you so much for signing up. And we don't just work with our members. Our members are really, really important to us. And if I reflect, when I joined the organisation over 6 years ago, we had 350 members, and to grow to over 4,000, I think, is a real achievement and a real testimony to the passion of people in making sure that, you know, we're working with health and care to make sure that we have the best outcomes from patients. And I want to pay tribute as well, because John mentioned the legacies that we've had, and we've been really successful in getting 3 legacies. But that is that, you know, people have died and given us money because they believe in what we're trying to achieve. And, you know, I really just want to say thank you to those people and their families for believing in the Patients Association, because, as John said, it's allowed us to recruit some more team members. And I'm delighted that we now have Orla, who's working directly with me on policy and public affairs and campaigns. And obviously, we've been really busy with a general election this year, and now very busy in making sure that the new government work with us and understand what patients are experiencing, and how working in partnership with those patients will result in better outcomes for patients, better services, you know, higher level of patient safety, but also more cost-effective services. So we're reaching out and we're working with government members at the moment to really try and influence that 100 days. And hopefully we'll be able to give you more on that. And then I want to reflect as well on what Julie talked about with the different groups that we sit on. And we continue to be representing patients. And we take what we hear from our members, but not only our members, we also work so that we can reach those voices that aren't heard. So pieces of work that we have done around listening to those voices of patients in left behind neighbourhoods, working with those patients who are at greater risk of health inequalities, and making sure that we're bringing those voices to the table when we're at, you know, within NHS or within the department. So I think that's really, really important. So the other thing I want to say to you is that in the last few months, we're seeing, and you know, great that patients can get to us, but patients are still struggling to access the services that we need, and we know that. And you know, the seminar before this around shared decision making is so important, because what we're hearing all the time from our helpline, and we've a very small helpline, and I think they're all on the call, so I want to say thank you so much to them as well. But you know, they have now seen an increase in calls of over 50% in the first half of this year. And you know, we're seeing more and more challenging calls where patients are really not able to find what the next step is. And it's really important for us to hear about those calls, because we can support the individual, we can try and help do more shared decision making, and that give them that power to be able to access the services they need. But the compliments that we get back in our helpline are really about thank you for listening. And I think that's the big thing that we were talking about shared decision making before, is people don't feel listened to. And in our Patient Partnership Week, we'll be doing a conversation around epistemic injustice, and how sometimes patient stories are disregarded as stories and patient experience is disregarded as stories. But there'll be more on that at the end of the slide. We then like Julie said, we've had a couple of webinars this year already, and one of the ones that we've done is very much around the untold stories and patients living with long-term conditions and how they're feeling abandoned by the system. And actually what we did with a 3-minute video of that is that we wrote to every prospective parliamentary candidate at the time to say, you need to listen to this and you need to really take this on board as you move forward towards trying to get elected into the next government. So we are now in contact with those people who came back to us and said, we want to work with you if we're elected. And we're gone back to, and this is across the political parties, obviously. And that's really, really, really important for us. And a couple of the projects that we've started at the moment is we completed our general election survey, and we did that so that we had information, up-to-date information about what patients were experiencing, so that again that we could talk to new government and that we could talk to the department. And I'm delighted to say that I have a few very important meetings over the next few weeks within the department to make sure that we're really getting that message across about communication, listening to patients, keeping patients informed, those patients who are on a long elective list, making sure that they know where they are and are getting that support to keep well. And of course, having that conversation with people about that need for prevention and the whole prevention strategy. And we need that. But we have millions of people who aren't able to go to work because they're waiting for treatment. And in our survey, it was 7 out of 10 people believed that public health needed to be prioritised, but that needs to be alongside us dealing with what's happening to patients at the moment. The other 2 members of staff that we appointed, and I think they're here as well, is Tom and Laura, and both of them have come in to support me with that projects and income generation. So we're more and more successful in terms of bidding for work where we can make sure that the department or NHS England or the piece of work is going to make sure that patient voices is coming to the fore of it. And one of the pieces of work we're doing at the moment is looking at social determinants of health around patients patients at risk of health inequity across the cancer and blood disorders. And that's a very big piece of work that we'll be reporting on. But at the moment, we already have a literature review on our website, which we've been sharing again with decision makers to say, this is what you need to be looking at. So Tom and Laura, I've mentioned you, and you're more than welcome. So Tom will be helping me lead on projects and looking to ways that we really develop the impact and the evaluation of all those projects, which is really, really important to us. So I think that, and obviously we've just voted in some more trustees, so that will really help with the organisational governance and the strategic plan. And as a team, we will be coming out to members over the next few weeks to really look at where we bring the organisation in the first 5 years. I've been with the organisation for just over 6 years. Like I've said, we've grown loads of areas. We're much more engaged with thousands of patients every year. But you know what? We need to take that next step, and we can't do that without our members. So I will be in touch with you to really find out how we can do that a little bit more. The other thing I just want to pick on, and I'm mindful that we're running out of time, but I saw Maya, thank you, put up a article around the COVID-19 inquiry, and I want to be really grateful to Carers Rights UK and John's campaign, who we're working in partnership with. And we're working much more in partnership with people than we used to in the past, which also is fantastic. And so I think the health module 3, there will be a hearing, and I think it's in early October, which all the information that you have been given us as members and those people who are non-members over the years of the pandemic, we've been pulling that all together with Lee Day, who are supporting us with this, to make sure that your voices are represented within that COVID inquiry. And then module 6, which is the social care inquiry, we're doing so much more on that. We've just put in our witness statement in partnership on that. So I think that probably is it. And we move on to the next slide, which I think is any questions. Now we've a couple of minutes and I'm going to have a quick look at questions, but while I do, I'm just going to hand over to Julie.
Thanks, Rachel. I just wanted to, before we close, just and look at some of the questions, say a few thank yous really, and I did sort of mention them earlier on, but first of all, just thank you to the members. You know, it's amazing having you and as part of the work that we do and the activities and the event that you get involved in, and we're always very grateful for that. And it's great to see the numbers increasing. So thank you. I'd also like to thank my fellow trustees. They work really hard for the Patients Association, and the broad range of skills and expertise that we have and the perspectives that they bring really enriches the conversations that we're able to have with at board. And I know Rachel and her team always find it really helpful to have those conversations. I'd also like to thank the staff. I think most of them are on here in the background, and they make the organisation what it is, and we're really grateful to them every day for the work that they do. They enable us to punch well above our weight in the health and social care environment, and they're all amazing. And I just wanted to thank them for making us relevant and credible in the way that they do. And then finally, I just really like to thank Rachel for her vision and her leadership of the organisation. She says she's been with us for 6 years. I've only been around for 3 of those, I think, but you know, it's a great pleasure working for Rachel. And for those of you who don't already know it, she's the staunchest advocate of patients, and never shies away from having a challenging conversation with anybody at any level about whether patients are getting the deal that they want, and that's incredibly important, and it makes us the high-profile organisation that we are. So thank you to Rachel for that, and again, thank you all for joining us this morning. And I think we're going to go to questions and answers now.
I've actually been very busily answering questions while you're talking here, and so I don't think there's any other questions, and I will answer the other 2 now. The income and expenditure table, we'll make sure that that's at the next AGM, but that is in the pack of information that we sent you. Brian, I think your conversation about moving away from charitable status to more services to a member like TriGenius, you and I have been picking up on that, and we will continue to talk about that. And James, thank you. I hadn't got your question. Yes, and that is the thing. And so the question is around measuring if your objectives have delivered an improvement both quantitatively and quantitatively. I can never say both of those words. And you're completely right. And I'm spending a day with trustees on the 12th of September. And one of the things Tom's been working with me on is looking at that, because, you know, figures are great, but that thing of getting patient experience. And I think if you ever hear me doing radio interview, I try to get away from that, just numbers, because behind each of those numbers, there is a patient waiting for treatment that's having an impact on them. And we've evidence of that impact on mental health. But yes, we definitely need to look better at the measures that we put in for our objectives, but Tom and myself will work on that. So I think that's all the questions, Julie.
There was one about how we calculate the reserves and what we seek for a reserve, which is set out in the longer financial report. But again, we can put that information back in reply to the questioner.
Brilliant, Don. Thank you for that. Anything else from anyone else? I just want to say a huge thank you to the members and people, because if we didn't have the voice of patients, then we wouldn't be able to I couldn't be as cranky as I am sometimes, Julie, with people. And I want to say thanks to Don as well as treasurer, because, you know, a small organisation, we've come from a place where when the first year I joined, we had a 280 deficit, and we've completely turned that around now. So hopefully, but that's not to say we can rest on our laurels. So Tom and Laura have a huge job to do, but we want to move forward, and I think there's a huge amount that we can do.
Thank you very much, Rachel. So I think, I don't know whether it's incumbent on me to close the meeting.
Yeah,
seeing as you opened it, but thank you everybody again, and we will see you again next year.
Thank you all.